A first question, Jerry, just what is medical child therapy?
It simply means that when you're doing psychotherapy with a child, you are also dealing with a child that has some sort of medical problem or physical problem which either exacerbates the child's emotional distress or perhaps is the source of the emotional distress.
So which do you focus on? Do you focus on the medical or do you focus on the psychological?
You have to get informed about the medical issues so you know the reality of what's there, but then you have to take your lead from the child in terms of what is the most troubling to them, and then you have to come up with a treatment plan that can involve both the medical team and the mental health needs of the child.
Is it theory-based? Is there a theory that you rely on when you work in this fashion?
I would think that there are several different systems of psychotherapy that might apply. I could imagine using some behavioral techniques, some psychodynamic interpretive modes. I like to think of myself as eclectic, and I guess that's one of the things we're going to be talking about that. But I would like to be able to draw on lots of different theoretical systems to propose interventions based on what I find out when I'm doing my assessment of the child.
Okay. And then you move into some form of an intervention?
Well, I first move into some form of testing the hypotheses, trying to collect some data. For example, one of the things you'll hear me do in this tape is I'm asking her, were there any stressful things happening in her life at various points in time, and I'm asking her about relationships with different people, and I want to know who's in her family and what's important to her. And I'm hoping that this is going to unfold and give me a picture of where the different stress points are in her life and as they affect this particular medical condition.
And if you're using techniques or anything like drawing, do you suggest that or have it available or, and let the child choose, or do you, from your knowledge of the child before?
Sometimes you'll have information before. I just try to have a lot of toys around that have creative uses. I like puppets. I like drawing. I don't like, there are some people who get very excited about finger paints and sand play. I learned early in my career that they're more aggravation than they're worth because you're worried about spending half of your session cleaning up after them. But I want to have something that will allow some creative freedom with the child. And you'll see quite clearly that I offer her some choices and she designates one that she's interested in, and we proceed along those lines.
What should our viewers look at when they watch this in terms of looking at what you're doing, and anything special?
I think they should watch how the little girl warms up. Her name is Leah, and they should watch how Leah warms up, how she becomes a little bit reserved, but she begins telling me things. I think it's also going to be very important to hear what Leah has to say about her family and her relationship with her mom, and to also listen to her description of the medical things that she's going through.
Let's watch.